Another COVID positive patient that I had, he was in an isolation room by himself, and he just looked so glum. I mean, he looked so sad and so, I mean, just desperate for, answers and for what the future would look like. I think he was probably in his 60s or 70s, so he was an at-risk population. And I walk in there and kind of just, give him some small talk to him, but he doesn't really want to engage. And this lady, I guess it was one of his friends, calls him, and she says, "Hey, I'm really worried about what might happen to you." And he said, "I know, I'm really worried too." And she says, "Well, she said, I want you to start thinking about what could possibly happen if you do die." She says, "Do you know what will happen to your soul? Do you know what will happen to you after, in the afterlife?" And he says, "I'm not completely sure." And she then proceeds to share the gospel with him of Jesus, right there while I'm kind of doing nursing care, getting blood draws, giving him his medications, and all these things, and just doing everything that I can to cluster care, right? Because we want to minimize exposure. And so I would sometimes be in there for an hour, hour and a half. And so I'm hearing this whole conversation while I'm doing all these different things for him. And then he prays for forgiveness of his sins and to ask Jesus to be his Lord and Savior. And so, I mean, it's just like the things that people were craving so much security. They were very scared. They were insecure. They were looking for answers about what could potentially happen to them, and so they were just hungry for human affection. They were hungry for compassion. They were hungry for comfort. And so that was, I feel like, my mission going in, and I feel like those interactions kind of really affirmed those things, that people were wanting those things, and that was why I was there, to just be a light in that dark place.